Patient Jeremiah was referred to us from a charity in Nicaragua, and he had a complex cardiac problem. The primary problem was that his heart had moved out of the thoracic cavity into the abdomen, and he had a defect in the abdominal wall.
This small boy, Jeremiah, small cute child, 10-month-old, of a very young parents. What happened to the child is when the child born, the parents noticed there is a pulsatile swelling in the upper abdomen.
Before arriving here, I was scared because I was thinking that I would have nobody to talk with or nobody that I can share my problems. But now I am happy and secure that my son is going to have his heart in the proper position where it should be.
And there is a defect in the abdominal wall here through which the intestine is coming out, and this is the heart. The defect is here. Actually the bone is not developed fully, and it's only up to here. The lower half of the bone is not there. From that gap between the diaphragm and the pericardium, the heart is coming out here. Actually that heart is just beneath the skin. The heart is there. Any trauma, anything can actually, even if you press hard also, that can even kill the baby. So this is very rare anomaly what we see, and this is what we are going to repair next week. This child, now everybody says actually in Nicaragua that is very big problem, it cannot be done. But I can tell you, I mean, it's a very complex and complicated problem, and the surgery is also very complicated going to be. But I'm sure he will come out of the surgery successfully, and the good aspect is this: he will grow like any other children, normal children, and he'll have a normal expectancy. He'll be a hero in Nicaragua.
I just want to thank you, and I just want to tell you how grateful I am that God is going to use your hands. I was waiting for this surgery since my son was born, and I am thankful with the Lord because He helped me to find the best doctors at the best hospital.
What the child had, it's a very complex condition, and it's very rare and very fatal condition. It's called the pentology of Cantrell. That is the medical term. Basically, the child had 5 problems. This condition is very rare. It is like 1 in 100,000 live births. That's all it's happened. Many doctors would not have even heard of or even seen this kind of cases or children. I have seen only once before when I was in India, and I have assisted one case, and this is the one I am doing myself as first time actually.
En particular, sí, tiene bastante.
I'm really happy that my son was able to have his surgery, and I would like to thank the doctors and everyone for all the care that my son have received, because everyone here have been very special and very attentive. I'm very happy that his recuperation have been successful, and I see a bright future for him ahead.
Y bueno, que el hospital es bastante acogedor, tiene buenas
I don't know what I
condiciones.
would do if he wasn't able to get the services he received at this facility. Before, I was very scared because I didn't even want my baby to enjoy or to play or even to crawl. I was very scared of him getting hurt. Now I see everything very different. Now he's a normal child. Now he will be able to play, to walk, to crawl, to run like any other child.
I can tell you, mother sent me a video last week, the child at home playing. Now he's like normal any other child, because all the problems are sorted out, and we have done echo after that multiple times. Everything is fine. The child will have a normal life now.
It's very hard to have a child in this condition, especially when you're not able, you don't have the means to pay for a surgery of this category. So it's very important to support this kind of foundations so other kids can get help. Please do not stop to support and help kids, because it's very hard not to have anyone to support. people that have the cases like the one I had.
I think one of the important things for an institution like Health City is that we have specialists who combine together to do complex work. So this patient was done successfully by both the plastic surgeon and the cardiac surgeon and had a successful outcome.
Darle gracias por todo.
I would like to say thank you to the both organizations that are helping me with my son. Have a heart and blessed back. I cannot express my gratefulness. I just want to thank them because they helped me to find the best doctors and the best hospital. So I ask God to bless them for their support and their love for me and my son.